In the following presentation, I'll briefly discuss the results of a pilot intervention involving an automated sexual history survey and the implementation of self-collection for extragenital chlamydia and gonorrhea specimens. The intervention was conducted at the Florida Department of Health in Alachua County and ran from August of 2020 to the following year of August of 2021. Clients 18 years or older receiving HIV care were asked to complete an automated sexual history survey at their routine clinic visits. And although the intervention was implemented across the entire patient population, I'll only be presenting the results among those clients who agreed to participate in this evaluation and provided informed consent. Prior to the intervention, chlamydia and gonorrhea testing was performed in urogenital sites as part of the annual physical, and extragenital sites were tested only when clients were symptomatic. With the intervention, clients were given an automated sexual history survey every 3 to 6 months at routine clinic visits, and bacterial STI testing was recommended based on clients' self-report of symptoms and their exposures and risks. When chlamydia and gonorrhea testing was recommended in pharyngeal or rectal sites, clients were provided a brief demonstration on the collection procedure and then given the choice between self or provider collection. And visual aids, such as the one you see here on the right, were posted in the clinic restroom for reference during the patient self-collection process. A total of 223 clients agreed to participate in the evaluation of the intervention, and across the 13-month intervention period, 8.1% of the study population tested positive for chlamydia or gonorrhea on one or more occasions. Rectal chlamydia and gonorrhea returned the highest incidence rate, with a 14% positivity rate among those tested, followed by urogenital chlamydia and gonorrhea at 4.8% incidence, and pharyngeal at 4%. There were 3 major impacts of the intervention. Extragenital testing was critical to appropriate diagnosis and treatment of chlamydia and gonorrhea, because in our investigation, 50% of chlamydia and gonorrhea infections among participants were in extragenital sites. 2/3 of these infections were asymptomatic, and all participants with extragenital infections screened negative in urine collected at the same time. Therefore, without the extragenital testing promoted by this intervention, these cases would have been missed. Second, automating the sexual history survey allowed our clinic to increase STI screening frequency to every 3 to 6 months, as opposed to once per year in the annual physical. And this took place without impacting clinic flow or placing burdens on the providers to collect detailed sexual history interviews at every clinic visit. And finally, clients strongly preferred to self-collect their rectal specimens, and those who self-collected either pharyngeal or rectal specimens reported that the collection process was easy to do, and there were no differences between the lab's ability to process samples obtained through self-collection versus provider collection. In conclusion, we saw a significant benefit to implementing the automated sexual history survey and self-collection of extragenital specimens. Both components of the intervention were successful in reducing barriers to screening and testing for bacterial STIs. This intervention improved detection of extragenital and asymptomatic cases of chlamydia and gonorrhea, and the intervention provided clients with increased agency and autonomy regarding their sexual health. STI rates have been rising steadily for years, and we feel that this intervention represents an easy-to-implement, highly successful approach to normalizing discussions of sexual health at every clinic visit. And this was an acceptable approach to both the clinic clients and the providers. Thank you so much for listening to our presentation. If you're interested in learning more and possibly how you could implement this at your clinic, please visit our website at targethiv.org for more information.